Welcome back to another episode on the Move, Talk, Thrive podcast. Today, we are continuing our conversation that we started last week, which was all around cognitive development and, in particular, executive function. We're going to unpack how we can identify executive function difficulties and differences, and really how we can layer some therapy approaches into our clinical sessions for better outcomes for children. I can't wait for you to listen to this episode. We will see you in there.
We are child development obsessed business besties and mums, and we're here to spill all our secrets.
We have a combined 30 years experience working with children, and each episode we will bring you up-to-date research and evidence-based strategies to set your children up to thrive.
I'm Lizzy Dawson, Australian exercise physiologist.
I'm Emily Mackey, Australian speech pathologist,
And this is the Move, Talk, Thrive podcast.
Hey, Lizzy.
Hello. Oh, I always get intro, what's it
It's
called?
good. It's good.
Oh,
You're good. You're good.
yeah.
We chatted last week, and that episode was a big hit. And we said in that episode that we would continue with executive function, and
Yeah.
that's what people seem to be interested in. So it's good. Good, we're on the
Yeah,
same
I think
page.
it's definitely a hot topic, and I think there's a couple of reasons why. I feel like I went to the ECA conference last year, Early Childhood Australia conference last year, and there was so much on executive function
Mm,
and brain development, and those sessions were absolutely jam-packed. Like it is front and center on educators' minds, and I think the reason for that is that behavior is uh is really impacted with executive function, because if
yeah.
we think about, let's unpack what executive function is firstly, and then I feel like it becomes really obvious why behavior is like an outcome of executive function difficulties.
Mm. I now that I'm a clinician, right, and
Yeah.
with experience, I sometimes look back at people in my life and just even sometimes kids at school and
Yep.
then people, adults that I've dealt with in my adult life and things like that. And sometimes I've looked back and actually thought, oh my gosh, they had executive function difficulties. I had no idea about that because I wasn't trained at the time. But now I look back and think, oh, I like, with being completely ignorant, I thought, oh, they were just like didn't care or they weren't, you know, attentive to details or they just couldn't process or, whatever. But now I'm like, oh my gosh, it makes so much sense. And it all becomes out in, like we say, behavior. It doesn't, when we're saying behavior, we're not meaning like challenging behavior, although that certainly falls into the category. It can
Yep.
sometimes just be the person is not like functioning and you're sort of going, hang on, what's going on here?
Yeah,
In a
it's like they're
conversation.
not cognitively engaged.
Yeah. Oh, so it might come across as like distant or not caring or something like that. But yeah, I'm
Yeah.
like that is probably how we're seeing it a lot.
Yeah, it's so interesting. It's really front and center in and around exercise therapy, because exercise boosts executive function skills, but because it increases vascularization in the frontal lobe, which is where the executive function skills are housed,
Mm.
I guess. So we increase blood flow and oxygen to that area with exercise. So it's definitely front and center for most exercise therapists. Um, so
Interesting.
yeah,
That I
it's
mean, it makes
I think
sense.
it's so interesting.
It is. And we talked in our episode last week, like you sort of started to unpack it in terms of like where does executive function sit as a goal? I think it was more for speechies because
Mm,
you guys do it, you said you do it all the time. And I was sort of saying, well, executive function would be like a big overarching goal, and then we'd have specific areas of therapy that we'd work on underneath it. But
yeah,
yeah,
right.
that's really interesting though, hearing that perspective from movement from you.
Yeah, yeah.
Hmm.
I'm actually talking so much about cognitive development and movement at the moment, because term 3 of the year we focus on that with all of our kindergarten programs. So
Mm.
we have like a cognitive skill that we're working on each week, and we'll break executive function up as well. So, executive function includes memory, working memory, cognitive flexibility, so being able to change activities, which of course transition kind of falls into that, or being able to problem solve. It includes
The impulses, inhibitory.
yes, inhibitory control, like massive one. And what are some other, like goal orientated behavior.
Mm,
So I think, when you think about impulse control and following complex instructions and memory, working memory and problem solving, like I feel like that's so closely linked to behavior.
mm,
So anyway, yeah, we've got a big focus on it at the moment. So a lot of my social media content is around brain development and movement, and
mm.
in particular executive function, because it's a bit of an area that I love. I've got a whole module on it in my courses. So yeah, I love it.
Yeah. It's something that I think as a speechy, I would break down into more specific goals rather than saying I'm focusing on
Mm,
executive function.
mm,
Executive function would probably be, like I said, the big overarching goal. But then
mm.
for me as a clinician, like it's different, I think, as a speechy, because that feels too vague to me.
Yeah,
Like too, not vague, too broad. So I'm like, still, what do I
yeah,
do in therapy, like to target that?
yeah, yeah,
But in when we break it down into working memory, for example,
yeah.
then we can look at, okay, well, how do we work on working memory as a goal and what exercises do we do? And sort of what area of therapy are we going to work on to help the working memory? Because, we can just, obviously, what I talk about a lot is language. So we can definitely be working on language goals to help working memory. But we can also be doing exercises and layering things in fluency therapy, like in stuttering, to
Mm.
help that working memory inadvertently. And often, sometimes when we like not overload, when we load a lot of cognitive skills in there, then the stutter can actually sometimes get worse. So we'd be working
100%.
on that.
Yeah,
Like it's sort of like, that's what I mean. Executive function is then overpinning a lot of different areas, even with articulation and pronunciation with children. They need to be able to, use that working memory skill to then actually produce the right sounds. So it,
yeah,
it correlates to so many different areas as a speech of what we'd work on. So it's
yeah.
always inadvertently, if we're looking at working memory, we should be working on it as species, which is the same as EPs, right?
Totally.
Yeah.
Absolutely. And so, something that I wanted to unpick with you, because I feel like this happens a lot. So, for example, you know, executive function skills would include following those like multi-step or complex instructions. Uh, yeah, I feel like that's probably like for me, like my obvious kind of connection. And I'm obviously not a speechy, but I think that because we use so much instructions in terms of exercise prescription, it's very naturally included in what we're doing. And quite often, I feel like there can be confusion as to whether this is an executive function difficulty or a specific skill in executive function, or is it a language difficulty? And I think something that I wanted to identify with you is how you would differentiate between the two. And I was saying to you offline before we jumped on, what I would do, because I feel like it's in my area of expertise, is I would use movement to identify if it's an executive function skill, sorry, or difficulty. So uh, I would do some, musical statues. Are they able to stop to the music, when we're playing their favorite song? Are they able to do the freeze game? Are they able to follow instructions? Are they able to remember different exercises and different sequences that we're asking them to do? Are they able to problem solve it? Are we able to build a building block tower, or change an obstacle course, or working with others and use their problem solving skills? And I've got some specific things that I would do to identify if it's executive function,
Mm.
because I don't have the tools in which, like, I've got very basic tools to identify if there's a language difficulty, which you have given me, and I've got kind of, milestones around that. But I was interested to hear how you would identify, is it a language difficulty or is it a cognitive difficulty?
Well, if you're talking about cognitive difficulty, you're talking about like intellectual. Are you talking like referring to like intellectual disability or not disability
No,
delays
no,
or
I guess if I'm more specific, how would you, because I feel like that instruction falls under executive function. So
Mm,
if we're confused about their receptive language,
yeah.
do you know what I mean? Like,
Yeah. It is hard, I think, to pull apart, because basically, if you're, I mean, it's not a given, but 9 times out of 10, if your executive functioning skills are not firing on all cylinders, so to speak,
yeah,
you are going to struggle to develop communication skills. And one area is language. So, in terms of if it's just a language delay or executive function, I feel like when I'm in therapy with a child, and I can see that they're struggling with instructions, they're struggling with concepts, they're struggling with um so recently there was a study that came out because it is hard to assess receptive language. Like it's really an area in research that's not a lot.
oh,
There's not
interesting.
a lot of research about it. There's a lot of research about expressive language because you can analyze what kids are saying, but receptively it's hard to
Yeah.
know. But there was a recent study that has come out this year, 2025, and it was referring to receptive language and executive functioning abilities with children. And they were saying that executive function may help children to process language input, so what's obviously being said to them, and to learn different types of sentence structures. So, we can say things very directly. We might use passive sentences. So that's not passive tone, but we might flip the words around so it's not as obvious. Executive function plays a huge role in children being able to understand those types of sentences and also then to process like when they've done something wrong and then revise it. So, like in change the interpretation of it. So, like say if a child says, oh, he did it, and the mum says, no, she did it. So then the child actually hears the difference between the he and the she. That's a role in working memory, and then can like then repeat it and say it on. So it'd be the same thing with exercise, right? If you're saying, I don't know, move your left hand, and they move their right hand, and then you say your left hand, like so that executive function, like this study shows that executive function plays a role in then being able to interpret that wrong part and then do it to the right part, to the instruction. So in terms like we know that, and we know that working memory is a part of that with also inhibitory control, all those things. So I think at the start it's really difficult to take apart, is it executive function or is it
Mm,
language? The only way that I would be able to do that is to go, I'm going to treat the language skills. And then when I do a standardized assessment and their language comes out within normal limits, if they then are still struggling to organize their thoughts. And so, what we kind of do is we'll work with the children at their age level, but then as they get older, then the same difficulties persist with language. And so, then it becomes a little bit more obvious that it's an ongoing issue, which may be executive function. But then there's also, do you know about developmental language disorder? Have we
yes,
spoken
a
about
little
that?
bit.
Yeah, DLD.
Yeah, I don't know whether we have, but I
We've
think
spoken
I've
about
definitely
that.
read research on it.
Yeah, so then it sort of then goes into like from a speechy point of view, if we're just talking about the language, okay, if this is a ongoing persisting language difficulty, then as the child goes into school, they may get diagnosed with developmental language disorder, which
Mm.
they can have executive function issues, but they may not. So it's sort of going, I think it comes back to looking at the child individually and looking at what's happening in their situation with all their diagnosis and health, things that are going on. Also looking at their environment, stimulation, like you said, gross motor, and going, what is happening here? But that's sort of, it's probably not as clear cut as what you were saying, and maybe what
Yeah.
you're wanting.
Yeah, no,
But
I
it's
mean, it's
hard
good
to
though,
know.
because I think so much of the time with kids, and what I feel like I'm working so often with allied health professionals through my courses is everyone's wanting that like black and white. And
No.
when you're working with kids, it's just not black and white. It's just a whole bunch of problem solving. And it's,
Yeah.
there's give and take in, and like in every session. And, some sessions are going to go to plan and some are not going to go to plan. And, some
Yeah.
sessions it's really about just layering therapy techniques in there. And some sessions you're just going to go, look, we're just not going to get anything, in
Yeah.
today. And I was talking to my team about it today and I said, some sessions it may be that you're playing a game and like you are just sitting there observing their posture, their tendencies in terms of movement and and you're changing the side that you're sitting on them so they're rotating differently and you're moving the games around and you might introduce heavy balls into the game. Like it might be so incredibly simple and gamified, but there's they might not go to, it might not be that they're doing like a specific exercise session. And a lot of the time that's not going to be how that's not going to be what happens when you're working with kids. I think, I'm listening to you talk and really likely they're going to coexist, like they're going to have speech difficulties and differences and executive function skill
Yeah.
differences. And there's these skills that sit under executive function, and they might have issues with one of them and not with the other.
Mm.
And I think it's just being aware of, how they might present and what it looks like if a child is having difficulty with it, and how we can measure it and
And what we can
give
do
it.
to support them, right?
Yeah, exactly. Like
Mm.
layer in some therapy techniques and activities to help support them. One
Which
thing that,
I was
sorry,
going to
you
say,
go.
which is what we've spoken about a lot. Like we've done a whole episode on transitions,
Yeah,
which is something that helps children with executive functioning difficulties. I think
yeah,
we've done a whole lot on visual schedules and, therapy routines, which again help children with these difficulties. So it's something that you probably naturally do to manage a session and manage a child and make it predictable for them, but it actually underpins executive function.
yeah,
Mm.
absolutely. I when I was doing through like my research with the University of Queensland, we were assessing the cognitive skills, in particular inhibitory control, after a 10-week Pilates intervention.
Mm.
And they use a couple of apps that test working memory and inhibitory control. They are research papers, and they've been developed by universities. One, and then you just download them, they're just apps on your phone. One's called Mr. Ant, and that's a working memory where it brings up different colored spots on the ant, and they have to remember where the spot was and tap where it is. And the other one's called Go No Go, which is they've got goldfish going over the screen, and they tap on the goldfish, and then they've got a shark and they have to not tap the shark.
Mm. Good
And
one.
yeah, really good ones, quite simple, and they've got normative data in there. So you put in the child's age and details, and it will tell you kind of whether it's below average or above average. And I know when I did it with my little one, my youngest son, he was below average. And interestingly, like he cannot stop himself from, taking the chip out of the chip container when he can't stop himself from starting dinner before we sit down. Like he
Mm.
just cannot stop himself from doing that. He can't stop himself from, getting too involved with the dog. Like it's just too tempting for him to stop.
Mm.
And there's some things that are coming up at school. And so that's something that I'm really focusing on him with. Like that's something that we're practicing in both
What do
our
you do?
therapy.
You do specific movement, like
Yeah.
exercises in Pilates to help that?
Yeah. So the things like we would gamify it. So, like I said, like a freeze game, really, really simple freeze game is going to help with like you play their favorite song, and are they able to stop themselves from moving when the music stops? And I just feel like that's such a simple game to play. All kids know it. And it's just, yeah, something that's quite easy to see. And you can tell these kids that can't stop themselves from doing it. You might do like traffic light games where you say, okay, when I hold up the red card, we're going to freeze on one foot. And when I hold the green card, you're going to move through the obstacle course. And so you might just do some cognitively engaging sort of exercises and games like that. Another big one we use is the blaze pods. I don't know if you've heard of blaze pods. They're these little lights, and they light up, and they need to tap them
Oh,
when they light up. So it's all reaction time.
cute.
Uh,
Yeah.
and you can have multiple colors, and you might say you've got to tap the green one and not the red one. So
Mm,
again, you're kind of practicing that. But obviously we're practicing it through our entire session because we're asking them to follow instructions. We're calling on their memory to then, go through and do different exercises. We're, asking them to behave and do certain
yeah.
things and not other things. Uh, like my son, when he walks into Pilates, he'll get the crash mats out and he'll just run and crash on the mats. And like there's another whole episode there on sensory, which we've to be honest probably talked about proprioceptive input in terms of regulation. But it's like saying, no, we're not doing the crash mats. We're going to do this, and we're going to work through this, and then we will do the
Mm,
crash mats. Are they able to stop themselves from
mm,
going into the crash mats? And again, they might be just really needing to regulate themselves. So providing them with exercises that are going to help them regulate through their proprioceptive system through like weighted balls and jumping and stomping is going to help with that. But
mm,
yeah, so that's some of the things, like even like a simple Simon Says game. And
mm,
we would just weave movement into it, and knowing that movement is, boosting the function of the frontal lobe, and that function of the frontal lobe is executive function. So
mm,
it's
mm.
yeah, it's really interesting. Actually, interesting story. My kids do Pilates in a group Pilates session at Kids Heart Pilates every Wednesday, and can be quite challenging, and because they're in a group, so it can be quite loud and overstimulating. Yesterday we did tennis before Pilates, and Georgia said they were like really good yesterday. Like their behavior was like considerably better than it usually is. And tennis is a cognitively engaging exercise. Like we've got a racket, we've got a ball, we've got other people, we're being asked to follow instructions. It's reaction time. It's like holding back from hitting it too hard. There's so much in there, and there is so much research around tennis in particular, and ping pong and cognitive function. So I think I thought that was really interesting, and I
Keep
wanted to
getting them
just,
to do the tennis.
yeah, or even incorporating it into what they're doing, like having some bat and ball games at the start of session, and or before doing this stuff before a task where they really need to focus, I think
Mm,
is
mm,
what we tend to recommend, brain breaks.
mm. It's really interesting hearing you talk because obviously you've got the two boys, I've got the two girls, right? And I think
Yeah.
I'm like, my kids would just never, ever, my girls would just never walk into a room and like start going into a crash mat. They would just be like, ew. Yeah. So
Mm.
I'm like, it's good discussion, right? Because boys, obviously, like we don't categorize boys and girls, but my
And to be
girls,
honest, I got two boys. One won't do that. Flynn will walk in and sit down.
yeah,
And Marley will just walk in, he'll look like what's going on, he'll talk to everyone, and then he'll get the mats out. But that's his way of regulating himself.
well, at least he knows to do that, right?
Yeah.
But it's really
Kind of.
interesting because the same difficulties would be present, say, in my girls, potentially like, but it's just quietly. And maybe
Yeah.
with girls, it's a little like not, I wouldn't say with girls, maybe with those kids who are a little bit more not
Reserve.
as physical, maybe.
Yeah. Yeah.
Um, or not as outward, like in movements and things. that then it's really important that we are then going, okay, and sometimes it's not challenging behavior, but it's looking at how they're approaching tasks and what they're doing in tasks. So
Mm.
and this is what I was saying at the start, like it may not necessarily be challenging the behavior, but
Mm.
when they're at a table and they're trying to, like if they're doing like a little game, like, pop the pirate or something, and we're giving them instructions in that game, it's looking at how they're approaching that task, their working memory in that, their planning, and like we said, their ability to be flexible. But
Yes.
it's in it's also really important to look at that in the small tasks, because I feel like that's where we could easily miss it, right? Because it's not challenging behavior. It's not like
Mm.
it's inconveniencing anyone, like it's not
Yeah.
like, oh, in your face. But it's really like like we said, executive functioning is so important, but that is like what school is. That's what the school system is. It's like sit down, focus, do very minute things, reading and writing and spelling and writing little letters. And it's in those we have to also like be very conscious of what they're doing there, which is what we would do in our assessments for literacy as a speechie. We're looking at all those little details. But I don't haven't looked into studies on boys and girls or different personality types and how
Mm.
that would display, right? Because it's interesting, isn't it? Like it's very easy to go, oh, like that kid there because they're very physical.
Yeah.
Whereas, like, yeah, I definitely think, and again, executive functioning is a skill that's developing. So we never expect our children, even typically developing children, to be like 100% there. Like it's developing even into the teens because the brain is developing. And so I look at Evie a lot, and she's 5, and I think, okay, we're like needing to work on these sorts of things, especially the impulses. And
Hmm.
so for me, it's trying to understand, is this like behavioral, or is like not behavioral, but say, is this an anxiety, or is this something else, or is this a processing and a planning thing? And so just trying to use clinical reasoning to figure out how do I best work on this, and also as a parent, like feedback to them, because sometimes as a parent, it's easy to be like, oh no, you did that wrong, or blah, blah, blah. But I'm like, hang on, like I need to teach you here, or what's happening. And it's very multi-layered, isn't it? It's very
Yeah.
multi, like
Yeah.
complex when you're trying to think through.
Yeah.
Yeah,
Yeah.
but it's
Yeah.
important, I think, to acknowledge the smaller tasks of where
Yeah.
executive function impacts
Yeah.
in that. Yeah,
Yeah. That are
and that
not
and that's
quite
just me thinking
as,
with my girls, right?
yeah, and not quite as obvious, I think. And I think
Yeah.
like with Marley, like a lot of that crashing, like I know him very well now, obviously, but that is a part of his regulation. So he's had a big day of school. He's gone to play tennis. We're now at Pilates, like massive day, to be honest. So is he just trying to regulate himself? Like
Mm.
every night he starts jumping on either his bed and his or the couch, but he's either tired, he's hungry, he needs to go to the toilet, he's thirsty. There's a lot of sensory uh
Mm.
yeah, not differences so much, but there's a lot of sensory needs, I would say, there, and reactions. So again, it's just being able to, I think it's just about understanding the whole child and all the intricacies that we're dealing with when we're dealing with when we're dealing with a developing person,
Mm.
which we all are in a sense, like you're working with older pops in neurological conditions, it's going to be the same. And that's what I quite often say to people that I work with on my courses. I'm like, most of this content, apart from how you would relate to a child and gamify what we're doing, is going to cross over into your neuro clients as an
Mm.
adult, because it's the same sort of principles. But
Yeah.
I think it's really understanding, so that, because as you said, you're more often than not going to be doing all these things. You're going to be asking them to use their working memory. You're going to be asking them to problem solve. You're going to be asking them to
Change
follow,
plans.
yeah, like follow goals, all of that those skills are required and we're going to be doing activities that are going to support that. It's about understanding that so we can communicate it and
Mm.
even just understand it so that we can really strengthen the therapy and layer in more therapy to understand what they're struggling with to make it more potent, I guess.
Yeah, absolutely. I think time is also a big factor, right? So often that's where children can struggle. Like if they're given too much time, they can't remember the instruction and they
Mm.
get a bit lost and distracted. Or sometimes if there's not enough time, they
Yeah,
can't get it all done.
yeah,
Time seems to be a big thing.
yeah.
And that component, it can either be small or big. And what I've found is that I will model like problem solving aloud. This is obviously at home. In my therapy sessions, it's a little bit different because we're focusing on the specific goals, but just generally, I'll be modeling what I am doing, like with my tasks and with my thinking. And I think that helps, but also then um, narrating my problem solving. So Evie's pretty
Mm.
clued. Like she'll say, "Mum, what's wrong?" And this week I locked myself out of the house, and so I was like, "Okay,
With her, was she with you?
yeah, Evie and Isabel with me. We were on the way to swimming, and I locked myself out of the house, and I was like, Mackie's at work. What am I going to do?" Again, like that's executive functioning, right?
Yeah,
Thinking under pressure. I've got two kids. It was cold, raining. I was like, we need to get to swimming. I've locked myself out. I can't open the car. What am I going to do? And
yeah.
so, like, I think naturally I'll just talk through things. But
Mm.
then she then started talking through, okay, she said, Mummy, what are you going to do? Which is one of the most helpful questions to start organizing your thoughts. Like, what's your plan next? What are you thinking?
Yeah, love
Um,
that.
Even like with books, I wonder what the character's going to do next,
Yeah,
So starting to model that. And I was like, I need to get into the house to get the car key. Even that just brings a little bit of order and logic to
yeah,
your brain. And so I was
yeah,
like, I'm going to go check all the doors. I'm going to go talk to the neighbor. I'm going to do X, Y, and Z. And so then I have noticed that that has really helped her. Or when
yeah,
she has a problem, I'll say, okay, so what's the plan? And even if she can come up with one step, that's executive function, right? And helping that problem solving, flexibility, working memory, putting it all together. Also impulsivity, like I could have just gone, oh my gosh,
yeah.
and give it into feelings of whatever. But, so it's
I
that,
probably would have done
that
that.
model as
Like
well.
you're listening to you going, yes, I am modeling
But I mean, that's
all the
just one
wrong things.
strategy that I think has helped in
Yeah,
reflection.
yeah.
Obviously in therapy, you're doing all those activities, like you said, instructions, giving time, prompting, not making things too complex or too layered. Like
But you're
particularly with,
modeling as well. Like you can model in your session. Whenever I have a child that is kind of resistant to do something or try something or engage, I'll be like, do you reckon I can do it?
yeah, yes,
Do you reckon,
yeah.
I don't know whether I can do it. Do you reckon I can do it? I think I can do it. And like we were doing this the other day, we were doing darts as part of it's this assessment research that we were helping UQ with, the University of Queensland. They're doing this motor assessment for autistic children because obviously it's quite difficult to go through with like a big standardized assessment.
Mm,
So one of them was throwing a dart and getting the dart on, it was throwing a ball actually, throwing the ball on a normal dart thing. And this little girl, she's level 3 autism, and she was just like, nah, not having a bar of it. I'm like, do you reckon I can do it? And she just like looked at me like it was just like ears pricked up. And I'm like, I don't think I can do it. What color do you reckon I'll hit? And then she's like, blue. And she just started, and that's part of the engagement. And one of the other practitioners was there as well. And I was like, do you reckon Georgia can do it? And she's like, no. And then Georgia did it. And you could go, do you reckon Georgia and I could get the yellow? And then do you reckon you could beat us? Like just I
mm,
think it's that's all like modeling going, oh, we're gonna try and do it. We're involved, like even, the parallel play and just
yeah.
modeling it in different ways, I think. And then again, what you're saying, layering in the language, narrating the
Mm.
process that you're going through so they can see that because they just pick all of that up.
Yeah, yeah, yeah. I mean, yeah, again, they're sort of typically developing. So, yeah, when we've got atypical developing children, it's different, but then we obviously have our specific therapy goals.
Yeah.
But yeah, so we've unpacked a lot there. There's also like a lot of food for thought in this chat, but I feel like executive function could be talked about for hours and hours and hours. There's so much to it and so much depth. And even if we had like a physio on or an OT, they would have a totally different perspective and it would be, different as well. But anyway, so we hope that this has been a good conversation for you to listen to, helpful. I will pop the research link in that I referenced for 2025 for speeches. And then Lizzy, did you want to pop in? Because you said that you wrote something in your courses.
Yeah, and I've got a blog that I just did on executive function. It's just gone out last week,
Yeah.
and
Is that
uh,
on your website?
it's on my website, so I'll pop the link
Yeah.
in the show notes. And there was something else I was going to say.
Yeah, you were saying something at the start about your courses.
Well, yeah, my courses, so child development and pediatric programming has got a whole module on cognitive development, and knowledge corner and movemental, my educator's course. I do a module in all of those on,
Yeah.
well, not just executive function, but cognitive skills and movement. In my blog, I also reference a research and the results linking movement like positive implications on executive function skills. So that
Yeah.
will be in
Okay.
there as well.
So we'll pop those in the show notes. If you have any questions or anything, please feel free to write into us or to send us a DM. We would love to hear from you. If you are enjoying the podcast, make sure you give us 5 stars or rate us 5 stars on whatever channel you're listening to. And until we talk to you next, we hope you have a really great day and a great week. And thank you for listening.
Bye.